Hello again everybody, back with another video. This one a follow-up to my last video, and we're looking at the vaxxed versus unvaxxed in terms of positive test, or cases as they call them, distribution in England. Now, the week I covered last time was week 42 of the Health Security Agency vaccine surveillance reports, and I reported that basically in week 43 they dropped the data I was covering. In fact, I was wrong, so apologies to the HSA there. They have actually moved it to a different table, to a different location, but the data is still there, so apologies to them and apologies to you for giving you false information, but they had moved it and it was quite difficult to find. Admittedly, I should have looked a bit better, but I have the data now, so I want to cover weeks 42, 43 and 44 to see if week 42 was a one-off or things are getting better or getting worse depending on which way you look at this. But let's get into the video now. So this is the government website, this is the link to take you there, and here are the reports that you can download from the new UK Health Security Agency website. So these are for England, and before I go on, I'd like to say that the data always appears to match the narrative, and I believe to a certain extent the narrative is the driver, but where data contradicts the narrative and edicts that come from it, I will expose it. But I will always say, always be careful, because there may be a narrative behind publishing this data. And we'll see later from what Bill Gates says. But let's move on and take a look. So here are the three reports. This is the front page of the PDF documents I downloaded for week 42, 43 and 44. And this was the table in the week 42 report that I reported in the previous video. I'll include it as well, but you can see it's with table 2. And it's with cases by vaccination status, and here's the data. Now this data is rates amongst people vaccinated with 2 doses per 100,000, and this is rates among persons not vaccinated per 100,000. So it is normalised, as they say in the scientific community, meaning it is the number per certain population of the vaccinated versus the rates amongst the unvaccinated per certain amount of population. So it is relative. So if this one, for example, was twice this one, then there'd be twice as many not vaccinated with the disease or alleged disease than the ones in the vaccinated group. So it is normal, it is good data to compare to each other. Okay, so this is weeks 43 and 44. You see now it's in table 5 and it's at the beginning. So I should have looked better to find it, but we do have the data for weeks 43 and weeks 44. So I'm going to go through all 3 of them now just to do the comparison. So here's the data that we need to look at, and you will see that I've put that into spreadsheets. So here's week 42. Well, it's in one spreadsheet on different worksheets, but to be technical. But this is week 42. This is the data, includes the under 18s, and I've excluded it to produce charts without the under 18s here. And you can see I've done the same for weeks 43 and weeks 44. And I've created charts from those so I can do meaningful comparisons. So let's have a look at the vaccinated versus unvaccinated for all age groups. So here's week 42, and we can see, this massive kind of anomaly for the under 18s, where we seem to have an enormous amount of rates per person that are not vaccinated compared to the vaccinated. Now, there's a lot of school children being tested, which might be what is creating this figure here, but you can see it's slightly higher in the vaccinated people to the slightly higher in the unvaccinated to the vaccinated for the 18s to 29s. But then as we move up the age group, we get a much greater rate of cases or positive tests within the vaccinated to the unvaccinated. And when we look at week 43, we've still got this big peak here, and we've still got this slightly greater amount of rates in the non-vaccinated to the vaccinated. So, based on those two, it looks like the vaxes are actually doing something, but then bear in mind there's not that many vaccinated here. But as we move up, then the rates in the vaccinated people increase dramatically over the unvaccinated. So as you can see, we get to the 30s to 80s, and then there are a lot more vaccinated people testing positive than the unvaccinated, which doesn't really go with the narrative that the vaccines prevent transmission to some extent. In fact, it kind of, with the older age group, it seems to be the opposite to that. And if we look at week 44, we can see we've still got this here. These two now are getting much closer, and in fact these are actually getting further apart. So there seems to be, just looking at this age group here, an actual increase in the rates amongst the vaccinated over the weeks, and that will become evident when we actually look at some of the comparisons. So let's have a look now at the vaccinated versus unvaccinated for the age groups of 18 plus. So what I've done is I've taken that first peak out, and you can see for week 42, for the majority of age groups, there are far more people testing positive in the vaccinated group than the unvaccinated group. So this is week 43. So if anything, this is actually extended, this difference here. These are getting closer, and then from then on you can see there's far more infection rates or positive tests or cases amongst the vaccinated than the unvaccinated. At week 44, that difference is increasing again, and these are getting very close. So starting to show clearly that there's more in the 18 plus group, a lot more positive tests in the vaccinated than the unvaccinated. Well, that is opposite to the narrative we've been told to date, but maybe there's a bit of a narrative in this, who knows, we'll see. Now if we look at the totals, so now looking at the vaccinated versus unvaccinated for all ages, so here we've got week 42, and the ratio of vaccinated positive tests to unvaccinated positive tests is 0.94. So there's clearly slightly more infections in the unvaccinated than the vaccinated. Bear in mind, this is being heavily influenced by that 3,000 figure in the under 18s. Now if we go to week 43, we've now just gone past the 50% mark, and we have basically more or slightly more positive tests or cases in the vaccinated than the unvaccinated. If we go to week 44, we're now at 1.09 ratio, and you can see here there's actually more, clearly more positive tests in the vaccinated than the unvaccinated. So let's take a look at that in comparison, on just looking at them quickly now. So this is week 42. This is the age group of all ages. Okay, so week 42, week 43, week 44, and I'll go back again. You see what's happening? It's actually increasing over the weeks. So let's move on, and let's take a look at the totals for the age group of 18 plus. So this was week 42 that I reported, And basically there's a significant difference now. We actually have 1.64 times more positive tests or cases or infections in the vaccinated than the unvaccinated. And bear in mind that this is the kind of age group that a lot of the mandates and restrictions in terms of vaccine passports are being applied to. So that starts to make no sense at all. But let's look at week 43. So we've now gone to 1.67 times more, and you can see the increase there. And let's go to week 44. We've got a 1.72 times. Yeah, so 1.72 times. I mean, that's getting up to twice as many, isn't it? Or close to twice as many positive tests in the vaccinated than the unvaccinated. So looking like for the age group of 18 plus, we've got a pandemic of the vaccinated, which is the opposite to what Sleepy Joe Biden has said. And if we look at that now quickly, so we can see the movement, week 42, week 43, and week 44, you can see it going up. We'll go back again and back again. So it is increasing across all age groups. But this is significant data. Okay. So what does the data show? Well, it clearly shows that in weeks 42, 43 and 44, the proportion of positive tests, officially called cases of course, in the fully vaccinated population of England is steadily increasing and has risen in all age groups from 0.94 to 1.09 in terms of the ratio of the vaxxed cases to the unvaxxed cases. And in week 44 there were 1.09 times more infections or cases or positive tests in the vaccinated population than the unvaccinated population. So this suggests that the vaccines aren't doing anything at all in terms of preventing infection. In all three reports, the data is heavily impacted by the very large number of under 18 cases, as we can see here. This was week 44. And take the under 18s data away, and there are 1.7 times more infections in the vax group for week 44. So there we go. So if you were to look at this, you would say that the actual vaccines are influencing the number of infections. Clearly obvious from that data, and there are a few little weasel explanations that are included in this report which do not account for this massive difference. This is a very significant difference. So what's the implications of this data? Well, the data should be applicable across the world because we are all human and we are allegedly being plagued by the same killer bug. And it basically firmly pushes vaccine passports and mandates into the unscientific, statistically unjust area of make-believe, basically. And if the governments or governors of this world are aware of the data, and we'll see what Bill Gates says, he seems to be aware of it, then moves to restrict unvaccinated people's privileges, must be pure coercion to get them to take the injection. And for the 18 plus age group, we appear to have a pandemic of the vaccinated rather than a pandemic of the unvaccinated. Now, just a few things are going on around the world. This is just looking at, let's put my screens, lost that for some reason. We've got Italy Green Pass triggers rise in COVID jab uptake, so they're celebrating that that's the case. Well, you tell people they can't do things or can't shop or can't work, then it's going to increase it. But based on that data we've just seen, why would you want to do this other than to coerce people to take the vax? We've got Sweden exempts vaccinated UK citizens from entry ban and test requirements. Well, based on that data, they should actually be doing the opposite. And then we've got here, Italy makes vaccine passports compulsory. Workers can be fined and suspended without pay. got to be illegal, all this shit has. How France tackled vaccine hesitancy. Well, they imposed blooming vaccine passports, didn't they? And they seem to be rejoicing in the fact that they've won. They've got people to take the vax. And then here we've got Lithuania, where you need to have a vaccine pass to go basically anywhere, any contact situation, shops, food, supermarkets, the lot. You've got to use a vax pass. So all this is happening when in fact, based on the UK or on the England data, then you're allowing a population of more infected people in than you would be allowing the unvaxxed in, based on that data, of course. And in the UK, we have this horrible rule on the 11th of November, the 11th of the 11th, Armistice Day. Well, there's obviously they like that number. Anybody working in a care home has to be vaccinated, otherwise they lose their job. And I know somebody at the moment is in the process of losing their job, and they actually work in an office with no contact with the residents at all, and they are losing their job because of this horrific, horrible legislation that's coming in, which does not, based on the data we've seen earlier, this has no justification at all. It's horrific, and you just have to wonder if these horrible puppet politicians who are just basically following their script, but they are instrumental in what's going on. So, damnation to all of you, you bunch of horrible creatures. Anyway, that's enough on that. So, let's have a look now at what Bill Gates has to say. And of course, Bill Gates in numerology is 33 for Masonry in Pythagorean numerology. We'll also take a look at some news about the pandemic of the unvaccinated, which from the evidence I've just presented doesn't exist. It's more the other way around than that. But let's just take a look at what he's got to say.
So it's 2015 that I gave the TED Talk and wrote a number of papers titled "We're Not Ready for the Next Pandemic." And sadly, that was a better forecast of what would happen than anyone would have wished for. The economic damage, the deaths, it's been completely horrific. And I would expect that will lead the R&D budgets to be focused on things we didn't have today. We didn't have vaccines that block transmission. We got vaccines that help you with your health, but they only slightly reduce the transmission.
We got vaccines that help you with your health, but they only slightly reduce the transmission. We got vaccines that help you with your health, but they only slightly reduce the transmission.
We need a new way of doing the vaccines. We didn't get much in the way of therapeutics. Dexamethasone and now molnupiravir could help, but way less than should have been the case. We didn't get the diagnostics up and running in order to, achieve what at least Australia and New Zealand showed, that competent management could keep the death rate down pretty dramatically. It'll take probably about $1 billion a year for a pandemic task force at the WHO level, which is doing the surveillance and actually doing what I call germ games, where you practice. You say, okay, what if a bioterrorist brought smallpox to 10 airports? How would the world respond to that? That there's naturally caused epidemics and bioterrorism caused epidemics that could even be way worse than what we experience today. And yet the advances in medical science should give us tools that we could do dramatically better. So you'd think this would be a priority. The next year will be where those allocations have to get made, including this global pandemic task force. The nice thing is a lot of the R&D we need to do to be ready for the next pandemic are things like making vaccines cheap, having big factories, eradicating the flu, getting rid of the common cold, making vaccines just a little patch you put on your arm, things that will be incredibly beneficial even in the years when we don't have pandemics. So, along with the climate message and the ongoing fight against disease of the poor, the pandemic preparedness is something I'll be talking about a lot. And I think it'll find fertile ground because, we lost trillions of dollars and millions of lives. And, citizens expect their governments not to let that happen again.
I just got a monthly briefing from my COVID team, and here's the latest data that confirms that we're still in a pandemic of the unvaccinated.
But first, here in Germany, officials say the number of daily new coronavirus infections has hit a new record. The German Institute for National Public Health says almost 34,000 new cases were recorded in a 24-hour period early Thursday. That's more than were recorded at the height of the pandemic's third wave back in April of this year. The German health minister says stricter measures are needed for those who refuse to get the jab. And it seems that that's prompting some people to reconsider.
It's not the latest fashion that's causing long lines at this shopping mall in central Berlin, but the chance to get a jab without an appointment. With COVID-19 infection rates skyrocketing all over the country and many vaccination centers already closed, the number of people dropping by here is on the rise.
I was recently on the road with my friends and we wanted to eat at a fast food restaurant. But I was kicked out because I am not fully vaccinated and only had done a rapid test.
I don't want to have to think about it anymore. When going to a restaurant or a club, I can then just prove I'm vaccinated and go in easily. And of course it's important to protect the elderly. Solidarity is important too.
But nonetheless, the numbers are very high and are rising. And the health minister, Jens Spahn, has spoken of a pandemic of the unvaccinated because those most affected by severe cases of coronavirus and those getting infected the most are those who are not vaccinated.
So still pushing the narrative that the unvaccinated are basically seething mass of festering infections that are putting the vaccinated, who are protected by a very, very good vaccine apparently, at risk. And so that narrative's being pushed, even though, as you can see, it's not correct. And the powers that be know it's not correct, as Bill Gates says. It slightly reduces, well, you could argue it slightly increases on the overall age range, and it dramatically increases on the 18 plus age range. But clearly they're going to push more and more drugs, and this one here is one that's being approved by the MHRA, the Medical Healthcare Products Regulatory Agency in the UK. And this one is apparently a breakthrough daily treatment to help prevent hospitalizations and death. But a daily treatment capsule on top of the vaccines? Or are these for the people who haven't got the vaccines, or what? I suggest that it's probably for the people with the vaccines who've got to take this one as well. Why would you need this if the vaccines are effective? And this product's called Lagevrio, and that just happens to be in Pythagorean numerology 44, which is death doors, which is a kill number, which is the same as what Pfizer is in numerology too. Very interesting, but as you can see, just a crock of shite basically across the board. So that's all I'll say. So thank you for watching, thank you for listening, and goodbye.